Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we are taking your calls right here, right now in the studio at 866-870-5752. And right now we are speaking with John in Long Beach.
Hey, John. Dr. Marc Darrow here. Please stick with me. I just got a couple things to mention to other callers. I'd love to hear from you at 866-870-5752. You can talk to me right now and ask any questions about musculoskeletal medicine. You know, that's anything from neck pain, back pain, shoulder tears, elbow problems, wrist problems, arthritis, fingers, wrist. I said that right. Hips, back, knees, muscle tears, tendon tears, Achilles tendonitis, plantar fasciitis, gamer's thumb, ankle arthritis, plantar fasciitis. I mean, there's just 10 million different things that can happen to our poor physical bodies. And I work on most of them by using PRP, which is platelet-rich plasma, and or stem cells, which are even more effective. So I hope you will call me up. If you don't get a chance right now, you can always write down the number to my office. We have people by the phones. And the number there is 800-300-9300 to the office, 800-300-9300. And by calling in, you get a free copy of my book, which is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And there's a foreword by the amazing Suzanne Summers, one of my favorite people on the planet, not only beautiful and very magnetic and very intelligent, but a proponent of the medicine that I do. And she actually wrote a chapter in her new book, which is A New Way to Age, the most cutting-edge advances in anti-aging. And there's a chapter starting on me on page 302 that goes on for quite some ways. It's I forgot how many pages, like a 10-page chapter or so, all about regenerative medicine, her success with it. And I've treated not only her, but her family and done very, very well with it. One last thing, John, I want to mention, that we'll get to you, is also in the office we do regenerative medicine of the face and the hair. I do it on the physical body. My wife does it on the head to thicken up hair for people, and on the face to regrow the collagen, and that gets rid of wrinkles and thickens up the collagen. As we age, we dry up all over the body. The discs and the spine dry up and people get shorter. I think my dad was about 6 feet, 6'1", and when he was young, and by the time he was ready to leave the planet at 90, his head was about the height of my chin. So he shrunk quite a bit. And all of us who are a little, what they call elderly, I don't know what that means anymore, because there's a new generation. You know, like 90 is the new, what they call it, the new 50. It's hysterical. But I get so many patients in their 90s who are still athletic and look great. And as I was talking to John about, activity is so important. Sports are so important, even if it's just walking, just to stay active. There's I live in the mountains, Santa Monica Mountains, and I was just out running yesterday, and there was a couple there in their 90s, and they were trucking along. And I met them before a couple months ago, and it was so funny. I said, "How old are you guys?" And they told me. And I said, "That's impossible." And they said, "Keep active, son. It's the only way you're going to stay young." And I said, "I'm doing my best." And John, I know you're doing your best, but you've got some issues. Where is your pain that you're having in your back? Is it neck or back or your thorax or what?
It's my lower back and my
Okay.
left leg.
Okay. So you mentioned stenosis, and stenosis means squeezing. And when someone has stenosis, when you look on an MRI or a CT scan, you're going to see a small opening either in the spinal canal or where the nerves come out from the spinal cord through what's called the foramen, or those are holes in the vertebrae. And there's probably millions of people that have spinal stenosis that don't know they have it because it's not an issue for them. So I want you to take that diagnosis and throw it away for right now.
Okay.
The fact that you have some issues in your leg obviously is a problem, but it's possible to get rid of those without surgery. So I always say be conservative in medicine. Always start with simple things. If it's nothing, that's the best. I kid my patients and I go, you're going to stay healthier if you just stay away from doctors totally, because I think it's the third cause of death in our country. What's the word, Anita? Do you remember?
Iatrogenic.
Oh my God, you are a genius. Yeah, iatrogenic means something bad happening to you because of doctors or medications or surgery or something like that. That's a big cause of death. We've had people call in the show that have had relatives or whatever have a surgery and die from them. I've seen it over and over. I'm not trying to put bad ideas in your head. If you need a surgery, get it. But the problem is most orthopedic surgeries that I see should never have been done in the first place.
So what you're saying is the one word that you don't want to hear from a surgeon is oops.
Yeah, that's right. And we hear it. You know, I've been in tons of surgeries. I love doing surgeries, and every rotation I could do in orthopedic surgery, I was the guy there. And I'll tell you the funniest. I mean, it's not funny, but this was not an orthopedic surgery. It was removing a cyst, an ovarian cyst, and so I was just a med student. I would be there holding clamps. That was my job, to hold the wound open. And most of the surgeries are actually done by residents in teaching hospitals. The surgeon stands there most of the time and instructs or doesn't do anything but just watch. And all of a sudden the surgeon goes, he screams, he goes, "I told you not to do that!"
Oops.
No one said oops, but he screamed at the resident. The resident is the the grad student, you might say. You know, it's a doctor who, you become a doctor when you graduate medical school. That's called Doctor, MD, or DO if you're a doctor of osteopathy. Then you do an internship, then you do a residency. And this was a resident who was doing the surgery, and he had cut the ureter. You know, that's the connection between the bladder and the urethra. And so he cut it, and that was the end of the game for that surgery for then. And they needed to call in a vascular specialist. And this was in Hawaii, and there's not too many vascular specialists in Hawaii. So they had to put the surgery on hold. They kept the patient sleeping, you know, unconscious. And they had to fly in the vascular surgeon from another island. And that took a couple hours to get him there. And so being the grunt there, I did the rounding on the patient the next day. And the patient said to me, as a woman obviously, who said, "Why was I under anesthesia for 5 hours?" And I said, "I don't know." And you know,
well,
I didn't want to get kicked out of. I didn't want to get kicked out of med school. And honestly, I didn't know enough about it to stick my nose in there. But she came out fine, thank goodness. But we see things. I saw a woman die on the table during a hip surgery. I've seen this way too many times where the anesthesia can kill people. And I just don't see great results from surgery. I'm sorry. I get way too many people.
Doctors are people too.
You know what? There's a human element in it. And doctors are great guys. I never put them down. I think everybody who gets through med school and residency has done real hard work, and the orthopedic surgeons probably work the hardest of just about any surgeons. Heart surgeons are real hard workers too. So I really take my hat off to surgeons because they do tough work, and it's dangerous work. It's dangerous for the patient. There's a lot of terrible side effects that happen. And good surgeons are also good doctors, where they know how to manage the patients if they go to the intensive care unit. They know the acid-base balance and all that kind of stuff too. So they know everything about medicine. So I'm not putting surgeons down. I lift them up, and God bless them for the work they do. It's just that in musculoskeletal medicine, sports medicine, all that, there's just way too many surgeries being done that should not be done, because regenerative medicine with platelets and stem cells now can heal the people. And I'm a living example of it. I've used this on me many, many times when my buddies who are orthopedic surgeons have said, you need a surgery. And I go, I'm not going to do it, because I had one for a shoulder problem that, basically ruined my shoulder for 4 years until I discovered regenerative medicine, injected myself, and healed it. So.
Well, thank goodness I've never had to have surgery. That's why I'm so interested in what you do.
I need to check you out, though, John. I need to get you into the office. The phone number is 800-300-9300 to my office, and give them a call. There's people by the phones now.
I will.
And I'd love to examine you and see what's going on. And there's a good possibility that even though you have spinal stenosis, it's not the cause of your leg issue. Just because you have a diagnosis doesn't mean you dig a grave. Okay?
Okay. I really appreciate all that information. I'll give them a call, talk to them. And again, you're doing just a lot of good stuff for a lot of good people out there.
I want to thank you for being a law enforcement agent. And how many years did you do that work? 20, 30 years?
Yep. 25 years.
25 years. So, yeah, that's pretty amazing work you do. And it's unfortunate today that, it's like during Vietnam, I was in the Army then, and nobody liked us. And with
me too.
Yeah, and you're in that same boat now with the way our social structure and the politics is working. So I really respect you guys for doing the work you do, putting yourself on the line. And unfortunately,
well, thank you for your service. I was in the Army too, and so that's hard as well. So I really
have to be honest.
I'll give your office a call.
I was only in the reserves.
Yeah, service is service. So there you go.
He's right. I agree.
All right. God bless you, John. And there's good hope for you with your back. And I'd love to see you again. If you want to call the office, you can call right now. There's people there, 800-300-9300. And for the rest of you who want to talk to me live, the phone number is 866-870-5752. Give us a call. We'll send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. There are 264 studies, I think, of research, real research, not fake stuff, real research on why surgeries are really not that great for you in musculoskeletal medicine, and how regenerative medicine, platelets and stem cells really do grow tissue and heal without surgery. So it's a great book. It took me 5 years to put the research together here, and I feel great about putting it out there, and it's yours for free if you give me a call on the radio right now. And it's all about how to heal without surgery. I'm not saying surgery isn't necessary at times, because it is, but most of the time it isn't, and it's a shame that it's done. In the office, we also do what's called the vampire facelift. By the way, Steve, we're going to get to you in a second. Vampire facelift is a great name. It was trademarked by, I forgot the doctor's name right now, but he's brilliant. And it's just injecting the face with platelets and regrowing the collagen and making people look young again. So, Steve, thank you so much for calling. It says here that you're an ex-patient. So I don't know which Steve
How are you?
I'm living it up, man. Who are you?
Me too, bro.
Do you want to?
I was your patient.
Oh, okay.
Earlier this year.
Okay, good.
I was a surfer kid. That 60-year-old surfer.
Yep, just like me. I'm the surfer that doesn't surf anymore, though. At the age of 74, I became afraid of the ocean after a great white shark experience.
Yeah, you told me that story. I told you about me surfing. I showed you my picture, then you picture of your son, and put me in my place.
Yeah, that picture of my son. Benji Darrow is a surfer at Mavericks, and in my office you'll see photos of him on a 60-foot wave, and he's what we call an adrenaline junkie, so the more dangerous, the more he likes it. And he's had some terrible injuries. I mean, I've injected him with some of the stuff that I do, but he's had to have surgeries for broken bones and have metal put in his leg. He was doing aerials at Mavericks and landed on his board and fractured his entire tibia and fibula. But he's back in the water. He's doing great, Steve. How about you? What's up with you?
Well, I'm back in the water. I had, I think, 3 treatments. The first one, I kind of went a little bit overboard and didn't rest. And then the next 2 seemed to do the trick.
Okay.
I'm giving you an unsolicited testimonial.
I love that. Thank you. I don't remember. What part of your body did we do?
It was my right knee, and I believe it was my outside meniscus.
Okay.
Yes, it was my outside meniscus. It was a little crunchy when I went in, and, I think I'm completely healed. I'm back in the water.
No,
been
God
in the
bless
water
you, man.
probably for the past.
It's wonderful.
Yes, I guess I did. I guess it did me around December and January.
Okay.
And it came out great. I'm doing really well.
You've given us great information, which we talked about in the first half hour, which is the people that don't heal are usually the people that are too active. And I raise my hand. I'm guilty of that too, because I've injected myself and then gone and done my sport the same day, whatever that was, for that day. And then the lucky thing about me is I can go back the day after I beat myself up and inject myself again and get the healing done. And
that is lucky.
I know. It's so, I can't tell you what it's like to have fallen into this line of work, because I have fixed every injury in my body so far to date. And that's 25 years of injuries. And being a surfer, you're going to be injured, and I'm here for you, obviously. I take care of tons of surfers. I think I get more golfers than anything else, which is always weird, because people say golf isn't a sport, it's a game. But people injure everything on their body from golf. But I get everything.
It's so funny, because my wife, I was talking to my wife about my knee just this week, and she's like, you got to call or you got to let people know that Marc Darrow, Dr. Marc did a good job, and let them know. So I jumped in my car just this morning. I'm a realtor, so I was just coming back from getting some keys to some people, and you were on the radio. So I dialed up, and here I am talking to Dr. Marc. Really nice guy. Listens to you and it worked for me. I'm here to say it worked.
Well, I really appreciate it, Steve. I mean, I remember you. You're a great guy. You're a typical surf, wonderful personality guy. And if you have a real estate deal, call me up for a real estate deal. I'm always looking.
All right. You got it, bro. You got it. And thank you so much.
All right. Well, I really appreciate your call so much. And thank your wife for pushing you to call up, too. Please do that.
Okay, you got it, Marc.
Yeah, thank you.
Thanks so much. Talk to you soon.
And Steve had a lateral meniscal tear, and we fixed that up. I've had medial meniscal tears in both my knees, and a patient came in with a meniscal tear, and I said to him, you know what, I got to check my meniscus. And I rolled up my pants, and I looked, and I saw that the meniscus was completely healed, and after it was just ripped up. I mean, it was an abomination when I first was treating it. So I'm very grateful to the work that I do on my patients and on myself. And again, it's not a miracle. It's just simple. It's using platelets, PRP, and stem cells. Just stimulates tissue growth. And it makes sense to do that to me rather than to operate and cut tissue out and destabilize an area. And when a joint or ligament tendon is destabilized, the next time you have an injury, you're getting ready for another surgery and then maybe a joint replacement. And I don't think those are good things to have. And sometimes people come out of surgery and they go, God, it works so great. And then a year or two later, they come back and they go, wow, it's really terrible now. I never should have done it. And now they want to do another or a third or a fourth surgery. And I always tell people, if you've had a surgery and it didn't work, don't go back for a second helping. Because if it tasted bad the first time, it's going to taste worse the second time. So I'm not a believer in these orthopedic surgeries unless it's mandatory. Emergency, great, go do it. Broken bone sticking out of the skin, yep, do it. But meniscal tears, rotator cuff tears, herniated discs, all these things that we hear about, please don't run and get a surgery. Check out regenerative medicine first, and be sure you go to a doctor who does it all day long, someone who uses an ultrasound to look inside and guide where the needle goes. Don't take anti-inflammatory medicine after a treatment. Stay away from ibuprofen. You can take things like Tylenol. We can give you something like Tramadol if you need that, stronger. But stay away from anti-inflammatories. We're trying to inflame the body. That's part of what healing is. And I know you come to me with some inflammation already. The body naturally tries to heal by inflaming itself. But sometimes it's not enough inflammation. So by doing these injections, not only is tissue stimulated with growth factors, stem cells, cytokines, all these things, but the inflammation, a short burst of inflammation, actually helps get the healing going even faster. So when I injure myself, I'll typically inject myself right away. I'm not going to wait. For other people, they want to wait for a while. That's fine with me. One common thing I see are ACL ruptures, anterior cruciate ligament ruptures, and the surgeons like to get them right in and use a graft from their patellar tendon or their hamstring or cadaver. A lot of times those will re-rip afterwards because it takes about 9 months for those to, I'll use a term, regroup. And actually what happens after that surgery is that tendon that's put in pretty much dissolves away and new tissue grows in. And why do that? Why have that surgery? Why have it at all when you can heal it just using PRP or stem cells? It doesn't make sense to me. The other thing is the research shows if you're going to have an ACL replacement surgically, wait for 3 months for the knee to heal up on its own and see if that'll happen. Another tidbit about that is, darn, get the blood out first. Use an ultrasound, take out the blood, aspirate it. To call my office, 800-300-9300. And to go to my website and watch videos of regenerative medicine stem cells, www.lastemcells.com. Get a free book. Call in. We love you. Thanks, Nita Valens. You're a great host.
Thank you, Dr. Darrow, Alex, and Suzette. See you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, To take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.